All right. So I'm a SUNY Plattsburgh nursing student going for my bachelor's, and for this semester I had to do a leadership management class. So we had to pick something that had to do with patient satisfaction, and the HCAPs reflect patient satisfaction. So I picked medication communication because that's one of the HCAP questions. The HCAPs are a survey that was the first standardized, publicly reported survey of patients' perspective of hospital care. So they collect data, and then you can look on the internet and see how hospitals compare nationally, regionally, and locally. With regards to med communication, the first question they ask on the HCAPs is a screening question to see if you even need to answer any more, and that is during the hospital stay, were you given any new medications that you hadn't taken before? And then if you answer yes to that, they ask, before giving you any new medicine, how often did the hospital staff tell you what the medicine was for? And then before giving you any new medication, how often did the hospital staff describe possible side effects to you so you could understand? And for those to score, you have to get always. And I thought this was interesting. I found this. 25% of patients said their physician never told them about a new medication, and only 10% said their physician discussed the side effects. And then the physician's perspective was 100% of physicians said they told their patients about new medicines, and 81% said they explained the side effects to patients. So it's good that we ask the patient's perspective so we can get an idea of if we're really doing our job as nurses, linking the doctors to and communicating so that everybody knows what's going on. So some ideas to improve patient satisfaction are to use keywords at key times, explaining what you're giving the patient and why. Assessing if they're understanding the knowledge that you're giving them, see if they're understanding the handouts that you're giving them. It says you need to repeat things 3 times so you can commit it to memory. I think it's way more than that, but
6 times for an average adult.
And they say to educate all the staff so that everybody knows what's going on. So when a patient walks in, oh, you're on pain medication, everybody kind of knows, like CTS patients here are on Lortabs or that kind of stuff. Also, another thing is bedside shift report is huge. If you read anything anywhere, they said like that's the best way to transition care because then the patient's involved with the outgoing nurse, oncoming nurse. So there's a 3-way situation going on there, and then everybody has the opportunity to know what's going on. It's a good teaching point too. And the last one is to make post-visit calls and include medication information. I know that we don't do that here, but to call a patient, just remind them and go over things and trigger them with the keywords that you've used would help them to comply more. So when you give a patient a medication, you should do 6 things. Name the medication, what they're getting and why they're getting it, how it works, what it's doing. So low pressure for blood pressure. The purpose of it, the duration of meds. Sometimes patients are just on meds within the hospital, sometimes they go home and they're on them forever, just to know, kind of gauge what they're getting it themselves into. When the medication will take effect, like an IV compared to a PO medication, the dosage, how much they're getting, if that dosage is going to change, like Coumadin depending on your INR. And then the side effects, obviously. Basic things like nausea, vomiting. If you feel those, we can do something to help that. So overall, just improve patient satisfaction. Patient satisfaction, you just need to communicate more about meds, why you're giving them, because the why makes patients comply more. Good?
Okay, very
Yeah.
good.